The essential thing is that we must protect patients from themselves. And when you are in an advanced disease state, your brain chemistry is gravely altered. And it is very, very difficult for us as doctors to tell between a brain depression, which we have a duty to treat, because it's disturbing the person's perception, right? And just the reaction of grief and existential distress of being a terminal patient. So I would put it to you that this bill is negligent in permitting some junior doctor who's only had 5 years out of university, typically 2 years as a junior house officer in the hospital, 3 years as a GP trainee, they qualify under this bill to issue a tick that this person knows all about the palliative care options. Tick, this person knows all about the new treatment possibilities in this special field of their disease. And tick, worst of all, I can say that this patient is not affected by depression, by dissociative states, by the cognitive changes of these powerful medications. They cannot. I promise you, I lecture these students, these GP trainees. They are not competent to do that. Under this bill, they are allowed to do it. That is a gross piece of negligence, which I'm sure you can fix. Please let there be a psychiatrist. Only they can protect the patient from their altered brain states and let them make their true decision, not their distorted decision. Please let there be a palliative specialist. It is a profoundly complex field of medicine. Some GP or junior doctor simply doesn't know what's possible, and surely this patient should be freed of unrealistic fears and returned to a state of reasonable expectation of how hard it'll be, not an unreasonable one. That's what the palliative doctors can do. And finally, the specialist in the field is vital. Without that, it's a wrongful death.